Good afternoon. Welcome to EduSet Network. Friend, as you know, the major constituent of our food is vitamins and minerals we take in different way. And when you know we like it, there are various kind of diseases we can get, and we can have a various kind of diseases in absence of the vitamins and minerals. And as you know, we have already discussed some of the diseases due to lack of the vitamins in previous month. And today we are going to discuss what are soluble vitamins. In absence of that, what kind of diseases we could get. So on discussion on this very topic, we have in the studio Professor Rasi Mukhopadhyay. She is teaching child development and education in Gargi College. So I hope her knowledge and experience will help us to understand this vitamins and minerals deficiency diseases in a new perspective, and will give a new insight into it. So on your behalf, I welcome Professor Mukhopadhyay for the EduSet lecture on this very topic. वेलकम मैम.
थैंक यू मिस्टर अमरिंदर. जैसे कि हमने पहले सीरीज़ में जाना है कि काफ़ी सारे न्यूट्रिएंट्स होते हैं हमारे फूड में और हमें एक बैलेंस डाइट लेना है, तो वो क्या क्या न्यूट्रिएंट्स हैं और हर एक न्यूट्रिएंट का क्या फंक्शन है, क्या सोर्स है, कहाँ से मिलता है, क्या उसके ना मिलने की वजह से कौन कौन सी डेफिशिएंसीज़ हो जाती हैं बॉडी में. उसी सीरीज़ को आगे बढ़ाते हुए आज हम जिस पे बात करेंगे वो है विटामिन्स, और थोड़े से हम मिनरल्स की बात करेंगे. अगर अक्सर एक बच्चे के से अगर हम बात करें तो अक्सर उसको ये लगता है, मम्मी पापा उससे हमेशा कहते हैं बेटा ये वाला खाना पूरा खाओ, बेटा खाना मत छोड़ो, उसके से तुम्हें विटामिन्स नहीं मिलेंगे, अरे थोड़ा तुम्हारे प्रोटीन की कमी हो जाएगी. तो हर बार पेरेंट्स बच्चों को यही बोलते हैं कि ये ले लो, पूरा खाना खाओ, सब चीज़ें खाओ जो हम दे रहे हैं. तो उन्हीं बातों को अगर हम एक थोड़ा रिकॉल करें तो हमें पता चलता है कि एक बैलेंस डाइट में काफ़ी सारे न्यूट्रिएंट्स होते हैं जो हमारी बॉडी में पर्याप्त मात्रा में पहुंचते हैं, और उनके क्या फंक्शंस हैं और क्या रोल्स हैं, उन्हीं सब पे हम बात करने के लिए आज हम बात करेंगे. और आज का हमारे जो चर्चा के विषय रहेंगे वो है वाटर सॉल्युबल विटामिन्स और मिनरल्स. तो उसके अंदर अगर हम थोड़ा सा रिकैप करें तो हम थोड़ा सा दोबारा रिवाइज करते हैं कि व्हाट आर विटामिन्स, व्हाट आर देयर फंक्शंस, एंड लेट्स टॉक अबाउट अ लिटिल अबाउट देम. So if we go back and revise, let's see, vitamins are organic compounds. They act essentially not only as catalysts, they are required in very small amounts in the body. They are not structural components of the body, but at the same time they are very vital to life. Vitamins also do not yield energy, they support health, they do not necessarily cure all ills, but they are better supplied through nutritious food than through supplements. That is why it is all the more important to have all the kinds and varieties of food on your plate while eating, so that you get all kinds of vitamins through the food and you don't need to take any supplements. Though there are a lot of supplements that are available which you can have on doctor's recommendation, but it is better always to have it from a nutritious diet. Let us also revise what are the various functions of vitamins. The first function of vitamin is that it is very essential for eye health and it supports healthy immune system. It assists with the absorption of calcium, it protects healthy cells, and it is important for blood clotting. All these functions we have talked about at length in the last segment. The other functions are that they are important in the function of nervous system and promotes normal appetite. They are important for protein metabolism, fat utilization, and red blood cells formation. They are essential in the synthesis of genetic material. Okay. Also we have that there are two types of vitamins: fat soluble vitamins, which are vitamin A, vitamin E, vitamin D, vitamin K, and water soluble, which are of two types, vitamin B, vitamin C. So today our area of focus will be the water soluble vitamins, and as we have already talked about fat soluble vitamins and their role and deficiencies that they result in. So under water soluble vitamins, we will talk about vitamin B and vitamin C. Now, as you know that there are various kinds of vitamin B that are there, we will talk about few major. The first vitamin that we are going to talk about will be vitamin B1. But before that, let's look at what are the various types and the functions of water soluble vitamins. Now, the first water soluble vitamin is that they are found in watery components of the food. They move directly into the blood when absorbed. So therefore you can understand how important these water soluble vitamins are. They move freely in blood and water filled components of the body. Kidneys are capable of removing small excesses. Large excesses overwhelm the system and may cause toxicity, about which we have already talked about, and they also need to be replenished in diet every 1 to 3 days. So you can imagine how important these vitamins are and how shortly they stay in the system. So every 3 days they need to be replenished. So suppose if a person is not eating a proper diet, you can see that in due course there will be certain deficiency which these vitamins will result in. Also, it is important to look at that you should not have these vitamins on more than in the required amount, because the excess will result in the toxicity of these vitamins. So this brings us to the first vitamin that we are going to talk about. It is vitamin B1. The name is the thiamine vitamin. Let's talk about the functions of this vitamin B1. It is an essential coenzyme for the decarboxylation of pyruvate to the acetyl coenzyme A in the Krebs cycle. Now this is a metabolism that functions in the body, which is very important for the absorption of the various formation of the various enzymes that are important for the metabolism of the body. So now this particular vitamin is very essential as a coenzyme for that. Now the second is that it is important for good appetite and normal digestion. Now what are the various sources? कहाँ से मिल सकते हैं ये vitamins हमें pulses, cereals, yeast, sprouted wheat, unpolished rice, soya bean, milk, green leafy vegetables. I think after this that you will remember how many times our mothers have told us to have green leafy vegetables, पत्ते वाली सब्जी खाओ, and I think that is one vegetable that we actually leave when we eat, because sometimes we don't think it is very tasty. So you can imagine that from where all sources we are getting this one essential vitamin B, thiamine. Now let's see, if we don't get vitamin B1 in desired quantity, then what is the deficiency? Now the deficiency disease that it results in, it is in beriberi. Now beriberi are of three kinds: dry beriberi, wet beriberi, and infantile beriberi. Let's look at what are the various symptoms, because whenever there is a disease, we may not know the when actually it begins, but there are certain symptoms that indicates कि yes, there is an onset of that disease. Now the dry beriberi symptoms for the dry beriberi include difficulty in walking, there is loss of feeling or sensation in hands and feet, there is loss of muscle function or paralysis of lower legs, which is happens in extreme deficiency conditions. Now that is dry beriberi. Now let's look at the various the more symptoms are, there is mental confusion, there is some speech difficulty, there can be pain, there can be strange eye movements, there can be tingling, and there can also be vomiting. That is for the dry beriberi. Let's look at the wet beriberi. Now wet beriberi, you can see that there is awakening at night, there is short of breath, there is increased heart rate, there is shortness of breath with activity, there is swelling of the lower legs. You can see in this picture that there is some kind of swelling which is there in the lower legs, which can be one indication of the wet beriberi. So you can see that there are serious implications of vitamin B1 if it doesn't come in the desired quantity. And if you recall that in the last time we had already talked about the structural component of all the vitamins, and also the various sources that it is there, but now we'll take up individual vitamins that are there. So let's go on to the next vitamin B, which is vitamin B2. It is called as riboflavin. Now the function is that it acts as a coenzyme in tissue oxidation. It acts as a coenzyme in respiration. It is involved in the metabolism of fat, carbohydrates and proteins. So you can imagine how important it is for the various metabolic processes. Now what are the sources? The sources are milk, soya beans, sprouted beet, papaya, banana. So you can see there are various certain foods that are also sources of vitamin B1 and vitamin B2. So let's now look at what happens if vitamin B2, which is riboflavin, doesn't reach to the body in desired amount. So the deficiency, that condition that arises due to less intake of riboflavin, is called as either riboflavin deficiency or it is called as ariboflavinosis. Now, but how will we know that we are having this condition? So the various symptoms are: there is cracked and red lips, there is inflammation of inner lining of the mouth and tongue, there also be mouth ulcers. If you look at this picture, you will see that there is crack at the corners of the mouth. Also there will be sore throat, there will be dry and scaling skin, there will be iron deficiency, anemia, and eyes may also become bloodshot, itchy, watery and sensitive to bright light. Now important point to focus here is that it is also a cause for the anemia, the iron deficiency anemia. Now we need to keep this in mind that about anemia. We will study this in our lecture further, but you will see that there are various causes of anemia. One of them is riboflavin, but there is also due to iron deficiency, there is also due to vitamin B12. So therefore, whenever there is anemia, we cannot directly say that, oh, it is because of this vitamin or it is because of iron. We need to go back to the symptoms which is specific for the anemia, and also we need to go back to the doctor and ask for a proper diagnosis. Now let's go back, let's look at the next vitamin, which is vitamin B3, niacin. What are the functions of niacin? Now niacin is essential component of coenzyme required for the metabolism of carbohydrate, proteins and fat. It is crucial for the proper functioning of intestinal tract. Now what are this, कहाँ से मिलेगा हमें विटामिन B3? हमें मिलेगा lean meat, liver, poultry, milk, leafy green vegetables. So again came the importance of the leafy green vegetables. I think today's program, mothers will be very happy to know that, see how important these vegetables and various pulses are in our diet, which children generally tend to leave and not eat at proper times. Now let's look at what is the deficiency disease that arise due to pellagra, due to niacin, and the deficiency disease is called as pellagra. Now if you see the picture, there is swelling of the tongue, there is lot of scaly skin sores which is of this. So therefore the symptoms for pellagra is there is delusions, diarrhea, there is inflamed mucous membranes, there is some mental confusion, and there is scaly skin sores. that is there. Now you can see that though these vitamins are required in very small quantities and are readily available in various vitamin sources, but even their deficiency is leading to such problems which can be very painful for a person. Now let's look at the next vitamin, which is vitamin B6. It is called as pyridoxine. What are the various functions? The functions are the coenzyme for the metabolism of amino acids, important for the biosynthesis of gamma-amino butyric acid. One very important thing is that one may not be able to see where exactly is this, but one needs to understand that these vitamins again act as the coenzymes for the various metabolic processes which are very vital to life. So therefore, if you recall that in the beginning I said that vitamins are very important for the life processes, and though they are not energy yielding or not the building blocks, but they are important for the metabolism of proteins, carbohydrates and lipids. Therefore they becomes very important part of the whole functioning system. So let's go on to the next vitamin, which is vitamin B12. Now vitamin B12 is called as cyanocobalamin. Let's look at the functions. It is important in the synthesis of DNA. It is involved in the various metabolism reactions of living system. Now you all know that DNA is the basic form of the genetic makeup of any human being. So you can imagine how important this vitamin B12 becomes, because it is important in the synthesis of DNA. It is also involved in the metabolism reactions of living system. So therefore this particular becomes very important part of the metabolic reactions in the body. Now let us look at where do we get this vitamin B12 or cyanocobalamin. Now it is naturally found in various animal products such as including fish, meat, poultry, eggs, milk and milk products. But it is generally not present in plant foods. Various breakfast cereals are fortified with cyanocobalamin. If you just recall that there are various products that are fortified with vitamins. Generally, if you are there eating some cereals in the morning, then there are various also ads for those cereals which says that this particular cereal is fortified with vitamins and minerals. ऐसा हमने बहुत बार सुना है कि एक प्रोडक्ट के अंदर विटामिन है, मिनरल्स हैं, तो हम हमेशा सोचते हैं ये कैसे आते हैं. ये इन प्रोडक्ट्स को फोर्टिफाइड किया जाता है विटामिन्स और मिनरल से, ताकि ये पर्याप्त मात्रा में किसी भी एक ह्यूमन बॉडी के अंदर पहुंच सके. अब बात ये है कि वाई दिस फोर्टिफिकेशन अकर्स. Now, I think at this point of time it is very important to understand the importance of fortification and the foods that are fortified. Now, as just we saw that cyanocobalamin is one vitamin which has very vital function, but it is also not present in plant foods. So, can we assume that vegetarians will not get cyanocobalamin? No, it is not like that. Certain foods can have added where through food processing processes there is addition of certain vitamins and minerals, so that the essential compounds that are not readily available naturally, they can also be made available through food for any person, so that you don't have to take supplements. If you recall that in the beginning I also mentioned that vitamins are much more easily absorbed than through naturally occurring food than through supplements. So therefore this process of fortification or addition of certain nutrients into the food so that it can be available to the person through the diet only. Now one very important and one very commonly available is iodized salt. Now the salt naturally doesn't have iodine, but also iodine is important for the human beings. Therefore iodine is added to the salt so that it can be easily absorbed by the body. Now please remember this iodized salt component. In the lecture further we will talk about iodine as an essential component and what are the various functions of iodine. But just to lay the emphasis of these fortified foods, I just gave an example. So now let us look at what is the deficiency disease that occurs due to the vitamin B12 or cyanocobalamin. Now it is called as megaloblastic anemia. Now again remember, just recall, we just now talked about one form of anemia where one vitamin was important for the iron absorption, otherwise it will result in anemia. Therefore in this also let's see how cyanocobalamin is leading to the megaloblastic anemia. Now what are the various symptoms? Now people with mild anemia may have no symptom, or if even they have symptoms they can be very mild. So therefore it becomes a little bit difficult to diagnose for the person himself or herself that probably there is an onset of anemia, because mild form of anemia does not have any kind of symptoms, or they can be very mild which is not recognizable, or probably one may ignore those symptoms. But a more typical symptoms of vitamin B12 or cyanocobalamin deficiency anemia includes one is diarrhea or constipation, there will be fatigue, or there will be lack of energy, or there will be lightheadedness when standing up with exertion, there might be loss of appetite. So these are very typical symptoms of vitamins that are there for the anemia that can be there resulting due to cyanocobalamin or vitamin B12 deficiency. If we look at the other symptoms can be, there will be pale skin, there will be problems in concentrating, there can be shortness of breath mostly during exercise, there can be swollen red tongue or bleeding gums. Often we avoid saying that there is a bleeding gum, it might be because we might have put the brush a little harder, or we might have hurt ourselves on the gums, or we might have touched our spoon a little hard on our teeth. But if there is a constant bleeding of gums, one should take it as a symptom to go and get oneself diagnosed for any kind of deficiency. Also there is swollen red tongue, there can be shortness of breath, especially when you are exercising. So one can see that how important this cyanocobalamin deficiency is. Now let's look at there can be also that due to continuous deficiency of B12, vitamin B12, it can lead to the nerve damage. So let's look at what are the symptoms from nerve damage caused by vitamin B12 deficiency that has been present for a longer time, but we may not have recognized. Now the various symptoms are: first, there is confusion or change in the mental status or dementia in several cases. There can be depression, there can be loss of balance, there can be numbness and tingling of hands and feet. So these are the various deficiencies which are there due to vitamin B12. Now let us just go back and recall and just revise that what are the essential functions of vitamin B. Now if we look at the various essential function of vitamin B is that it acts as coenzyme for various metabolic reactions. It is important for the synthesis of DNA. It is important for the absorption of the fats, proteins and carbohydrates. Now if this is the important function, therefore their deficiency can lead to various things, as we saw that vitamin B1 is leading to beriberi, vitamin B3, B6, B12. So there is araboflavinosis, there is megaloblastic anemia, there is pellagra. So one needs to be a little careful and look at the various symptoms that we have talked about, so that before there is severe deficiency, one can have the various good sources of that vitamin in our diet, and if required, vitamin supplements, so that the deficiency can be taken care of. Now vitamin B was one of the water soluble vitamin. The next water soluble vitamin that we are going to talk about is vitamin C or ascorbic acid. Now vitamin C is something that every child must have heard from parents, as when I used to go back to my Nani's place, she used to always say, have lemon while having food, it helps in digestion, and have orange. So we used to always have these things because she was saying, but it is only later that when we were studying about this, we realized the importance of vitamin C as a component in the food and why it is very important to have it in our diet. So let's look at the functions of vitamin C. The first function is that it is concerned with many metabolic reactions. It participates in wound healing stages of the body. Now you can imagine how important this is, that suppose if there is a wound and it is vitamin C which is a participatory component in the healing of the wound. So therefore if the healing of the wound doesn't occur, you can imagine what state a person can come into. So that is the essential functions of vitamin C. Let us look at what are the sources. Where do we get vitamin C from? The most important is the various citrus and sweet fruits that are available. So oranges, lemons, mosmi, all these citrus fruits are good source of vitamin C. Even we get vitamin C from green leafy vegetables. So we can see what are the various sources, and that is why in some households you see that थोड़ा नींबू निचोड़ देते हैं दाल के ऊपर, नहीं तो सलाद में हमेशा नींबू थोड़ा काट के देते हैं. क्यों? Because it also helps in the digestion of various other components. As we said that it is very essential component of metabolic reactions. It is also with the presence of vitamin C, certain other nutrients get absorbed in the body. Therefore vitamin C or ascorbic acid becomes very important. Let us look at what is the deficiency disease that deficiency of vitamin C result in. Now it is called as scurvy. Now how do we know what are the various symptoms of scurvy? There is general weakness, there is anemia, there is gum disease, there is skin hemorrhage. If you see the picture, you can see that there is swollen tongue. There is certain lesions that are there in the tongue, which is very essential symptom of scurvy. Now, with this, we end the components of vitamins. We have so just let's revise that vitamins are very essential or vital components for the metabolism of the body. They are not energy yielding components, but they are important for the functions. There are two kinds of vitamin. One is fat soluble vitamin and one are water soluble vitamins. The fat soluble vitamins are A, D, E, K, and water soluble vitamins are vitamin B and vitamin C. They are, now what are the characteristics of water soluble vitamins? That they are easily absorbed into the body. They directly enter into the blood after absorptions. They are available in the system for 1 to 3 days, and they need to be constantly replenished. We have talked about various functions, that how important they are, the various sources which are from where they are available, and also what are the various deficiencies they result in if they do not if they are not supplied into the body at in appropriate recommended amounts. So this is what is vitamins. We have finished the vitamin. Now we will talk about the minerals that are there. Generally we always say that food is fortified with vitamins and minerals. Now what are these minerals? How important they are? What are the minerals which are required in more quantity? Are there any minerals which are required in less quantity? If that is so, and what are the various functions of those minerals? Why are minerals so important for our body? So to look at all those things, we will today take up minerals, the characteristics of minerals, what are the various types of minerals, and we will talk about two important minerals for the body. So let us look at the let us see what minerals are. Now minerals, the moment this word comes into us, there is something that we say, okay, minerals are something which are found in the soil, or it is like iron or calcium or magnesium. So how are these important for a human being, and are they found in various vegetables or the meat products or the milk products that are there? So let us look at what minerals are essentially. Now minerals are nutrients that are needed by body in very small amounts, and they help it function properly and stay strong. Now humans need small amounts of about 25 minerals to maintain normal body function and good health. It is 16 of which are essential nutrients, and they must be supplied by the diet. Now they are important nutrients found in foods, and one should not forget that minerals are inorganic substances. Now let us see, I just said that 16 of which are essential nutrients. Now there are two categories. One are essential minerals, one are non-essential minerals. Essential minerals are those minerals which are required by the body, and if they are not present can lead to serious ailments or disorders or their deficiency diseases. The other non-essential minerals are those which can be there, which will be absorbed by the body, but if they are not there, it may not affect the metabolic functioning of the body. So let us look at what are the various types of minerals. Now if we look at, there are two types of minerals. One are macro minerals and one are micro minerals. Now let us see what are the various macrominerals and microminerals, and then I will go on to the definitions of defining them. Macrominerals are calcium, magnesium, sodium, potassium, phosphorus, and chlorine. Microminerals are iron, cobalt, chromium, copper, iodine, manganese, selenium, zinc, and molybdenum. Now these are microminerals and these are macrominerals. Let us look at what are macrominerals. The first type is sometimes which we call as major minerals or macrominerals. Now what are they? Now macrominerals are needed in diet in amounts of 100 milligrams or more each day. This is very important, that you require these components 100 milligram each day. Now they are present in virtually all cells of the body. They are essential for maintaining general homeostasis and are required for normal functioning. Their acute imbalances of these minerals can be potentially fatal, although nutrition is rarely the cause of these cases. Now these are called as macrominerals or major minerals. So the other set of minerals are the trace minerals or the microminerals. That is the another name. Now what are trace minerals? Trace minerals are micronutrients that are chemical elements. They are needed by the human body in very small quantities, generally less than 100 milligram per day. This is one major point of difference, that more than 100 milligrams per day requirement makes them macrominerals, less than 100 milligrams per day makes them microminerals or the trace minerals. Now let us look at what are the various sources for all the kinds of mineral. Like for calcium, dairy products and green leafy vegetables. I am pretty sure the moment you heard calcium and dairy products and green leafy vegetables, you will immediately recall your parents saying दूध पियो, रोज सुबह शाम को दूध पीना चाहिए, you should have a bowl of curd. All these things are very essential. Why? Because for them they understand that it is very important mineral calcium which is supplied through these products. Now let us see the sources for magnesium. They are nuts, soybean and cocoa. Let us look at the sources for sodium. It is table salt, which is sodium chloride, the main source. So you can imagine the importance of salt, milk and spinach, so palak. Now for potassium, it is legumes, whole grains and bananas, and for iron it is red meat, leafy vegetables, especially spinach. If you see that, you can see all these amounts are what are part of your daily balanced diet, and also all these components are very important in the food. So let us look at the first mineral. We will only talk about two minerals today. One will be iron and one will be iodine. Now why I have selected only these two is that I selected iron is, remember I asked you to focus on anemia, that therefore because iron deficiency also leads to anemia, I thought it is important to talk about iron as a mineral today. We have already talked about one vitamin deficiency leading to the anemia and another megaloblastic anemia. So today I also thought about that one should also know that there is another form of anemia which is due to iron deficiency. Therefore I selected iron. And also remember that we are talking about certain products in which various nutrients are added. In that context also, I thought, let us talk about iodine as an important mineral for diet, so that one knows that why it is important to have salt in our, and why do we have salt in our whole food preparations. I just told you that salt is important for sodium as a mineral, but there is also addition of iodine. Therefore, we do not have only salt, we always have iodized salt. Now, therefore, to look at that component of iodized salt, we are looking at iodine as a mineral. So today I am talking about iron and iodine. Let's just look at iron. Now what is iron? Body needs iron to transport oxygen from your lungs to the rest of your body. So you can imagine the importance of iron. The another important function of iron is the formation of hemoglobin, which is part of red blood cells that carries oxygen throughout the body. It is essential for the regulation of cell growth and differentiation. So after immediately you can understand that how important is iron as a component, because it is directly related to the transportation of oxygen to the various part of the body. So you can well imagine how important this iron is. Let us look at which are the foods through which we get iron, or which are the foods that are rich in iron. Meat, especially red meat such as beef. There is tuna, salmon, eggs, beans, baked potato with skins, dried fruits like raisins, leafy green vegetables such as broccoli, whole and enriched grains like wheat and oats. So you can imagine what all components of food give us iron. Therefore, many times we always say that have whole wheat breads rather than white breads, or breads that are made from maida. So why? Because this whole wheat, this covering of the wheat is removed, and which also takes away various essential vitamins and minerals. So these are the various foods which are rich in iron, that give us in specific quantities for the body. Now let us look at the deficiency that arises due to non-consumption in a proper required amount. Now, as we have already talked about, it is anemia, but it is iron deficiency anemia. Let us look at the symptoms of this anemia. Now, the symptoms are, there is blue color to whites of the eyes. There are so you can imagine that the white of the eye is started turning to blue, because you can a simple thing that the oxygen is not reaching to all parts of the body. Their nails become brittle. Also, the appetite of a person decreases, which is very specific to children. So the moment they start saying that we are not feeling hungry, there is a decreased appetite, you can see that there can be signs. But don't say that if it is one day that the child is not feeling hungry, oh, my child is having a problem. It is not like that. It has to be a prolonged symptom to go for a conclusion. Now, there's also, it accompanies with fatigue, which it also is accompanied with headache. The other symptoms are, there is irritability, there is pale skin color, there is shortness of breath, there is sore tongue, there will be food cravings of unusual type. You want to have food which sometimes may not be classified as food. and there will be a constant feeling of weakness. Now all these are the symptoms of anemia. So if anybody is having such symptoms, one can one can look into the signs for anemia, which is due to iron deficiency and not due to vitamin deficiency. Now the next important mineral that we are going to talk about is the iodine. Now iodine is as a function is that it is as a constituent of hormone thyroxine, which is secreted by the thyroid gland. And you know the functions of thyroid gland, that it affects the growth, development and the metabolic rate of the body. We all know that this is the function of the thyroid gland, that it is important for the growth of a person, it is important for the development of the person, and also for the various metabolic reactions that are happening into the body. Now iodine is important component of that thyroxine. So therefore you can imagine how important this trace mineral becomes for a human body. Now another important function of the human iodine is that it plays an important role in the efficient conversion of beta carotene to vitamin A, with a subsequent increase in the efficacy of protein synthesis and cholesterol absorption. So you can see how important it is for the absorption of vitamin A, for the protein synthesis and cholesterol absorption. So again it is very important for vitamin absorption, for protein absorption and for fat, which is again we have been talking about since the beginning of the lecture, that how these vitamins and minerals are important for the absorptions of protein, carbohydrates and fats. Now let us look at what are the sources of iodine. Now the various sources are seaweed, dairy products, strawberries, eggs, ocean fish and food that contains iodized salt. So again it is very important to look at this component, that the salt is iodized. The naturally occurring salt doesn't have iodine, but the iodine is added to the salt, which becomes a very good source of iodine. So there are other foods also, like let's say strawberry. Now strawberry is not available in all parts of a country, so therefore how we will have, and also strawberry is also not available throughout the year, so therefore iodized salt becomes the prime important source of the iodine. Let us look at the symptoms. Now the deficiency which is resulted due to the condition that is resulted due to the deficiency of iodine is called as goiter. Now what are the symptoms? The main symptom is the swollen of the thyroid gland. Now this swollen thyroid gland, the size may range from single small nodule to a large neck lump. Sometimes you have seen that there is a large neck or there is a swollen neck, which is due to the swollen of the thyroid gland. Now swollen thyroid can put pressure on the windpipe and esophagus, which can lead to breathing difficulties, may rarely occur with very large goiters, cough, hoarseness and also swallowing difficulties. There may be neck vein swelling and dizziness when arms are raised above the head, and these are very prime symptoms of deficiencies that are the iodine deficiency, and this is goiter. Now this brings us to the end of lecture, where we have to sum up, we have talked about deficiencies of vitamin, we have talked about deficiency conditions occurring due to mineral deficiencies, and basically in today's lecture due to iron deficiency and due to iodine deficiency. So this is, and we have also talked about various symptoms that one which is very important to look at. Now one very important thing is that certain symptoms that we have talked about are symptoms that a person might feel probably once in a while or daily. Like if today I am feeling very tired, that doesn't mean that it is because of a deficiency. It can be because I have worked too much, or I have probably ran, or I went for a jogging, or there can be multiple activities that I have done. So therefore that one symptom has arisen which is also symptom for other conditions. The important thing here is that all these symptoms need to have a consistency in their occurring and have been there for some time. Therefore it needs to be, that is important factor. Also one should not ignore one symptom. Like suppose if I am feeling tired today, I might say, oh, I might be feeling tired because I have done too much of work, or I ran, or I went for a jogging. But is it that I have actually done all those activities and I have rested and I'm still feeling tired? So also these symptoms should not be ignored. They should be thought about. One should also think that, am I feeling tired daily? Is it a thing that is happening with me over a period of time? So everybody should not ignore these symptoms, and they should go to proper diagnosis for any deficiencies, so that proper care can be taken, proper supplements or a diet plan can be made according to the condition of a person, so that a person can lead a healthy life. So with this we have talked about the various importance of vitamins and minerals.
Okay, how one can determine that this is because of the deficiency of vitamins, it is not because of the diseases? Because it is very difficult to find out this thin line.
ओके जैसे मैंने अपने लेक्चर में कहा कि कुछ कंडीशंस ऐसी हैं जो विटामिन की डेफिशिएंसी से भी होती है, मिनरल की डेफिशिएंसी से भी होती है. कुछ ऐसे सिम्टम्स हैं जो हम हमेशा हमारे अंदर हमें लगता है कि कोई बात नहीं, हम तो हमारे साथ ऐसा होता रहता है. तो दो बातें जो ध्यान में रखने की है वो एक ये है कि क्या ऐसे सिम्टम्स मुझे बार बार आ रहे हैं. जैसे फॉर एग्जांपल ब्लीडिंग ऑफ गम्स. क्या मेरे दांतों में से खून निकलना क्या एक बार की बात थी, या वो मेरे साथ हर रोज़ हो रहा है, या मैंने कुछ ऐसा किया जिसकी वजह से ऐसा हो रहा है, या किस समय मुझे ऐसा कंटिन्यूसली होता था. तो ये सब बातें ध्यान में रखने की है. मतलब कहने की बात यह है कि कोई भी अगर एक ऐसी बात है जो आपके साथ अनयूजुअल हो रही है, उसे इग्नोर ना करें, लेकिन उससे ये भी ना सोचें कि मेरे को किसी चीज़ से डेफिशिएंसी है इसीलिए ये हो रहा है. अगर ये चीज़ कंसिस्टेंटली हो रही है और काफ़ी समय तक होती रहती है, तो मतलब हमें ध्यान देने की ज़रूरत है, हमें इसका प्रॉपर डायग्नोसिस लेने की ज़रूरत है. ऑफ कोर्स डॉक्टर के पास जब जाते हैं तो वो टेस्ट प्रिस्क्राइब करते हैं, जिससे पता चल जाता है कि किस चीज़ की कमी के कारण हमें वो कंडीशन हो रही है.
तो यहाँ पे दो चीज़, एक तो डॉक्टर्स पॉइंट ऑफ व्यू हुआ, एक न्यूट्रिशनिस्ट पॉइंट ऑफ व्यू हुआ. तो उसमें कैसे डिफरेंस है? जैसे ब्लीडिंग ऑफ गम, तो मे बी ड्यू टू डिफिशियंसी ऑफ सर्टेन विटामिन्स, ये हो सकता है दूसरे बीमारी के कारण हो. तो ये पता करना कि डॉक्टर तो मेडिसिन चला देते हैं, जो भी गए हैं जहाँ मेडिसिन होते देंगे.
डॉक्टर मेडिसिन तो देंगे, लेकिन डॉक्टर आपको एक्सप्लेन करके बताएंगे कि देखिए ये विटामिन सी की वजह से, सब फॉर एग्जांपल विटामिन सी की वजह से हो रही है, तो मैं आपको विटामिन सी सप्लीमेंट दे रहा हूँ. लेकिन आपको ये भी बात ध्यान में रखनी चाहिए, जैसा हमने अपने काफ़ी लेक्चर्स में बात की है, कि जितने नेचुरली अकरिंग सोर्सेज हैं वो ज़्यादा रिच होते हैं रादर देन सप्लीमेंट्स. तो सप्लीमेंट्स आप ले सकते हैं कुछ समय तक, और सारे डॉक्टर्स भी यही बोलते हैं कि कुछ समय तक ले लीजिए ताकि वो डेफिशिएंसी ख़त्म हो जाए, लेकिन उसके बाद अपनी डाइट में कौन कौन से चीज खाने के पदार्थ आपको इंक्लूड करने हैं जो कि उस पर्टिकुलर विटामिन में रिच हैं, तो वो सप्लाई करने के लिए आपको कौन कौन से फूड लेना है। जैसे हम अगर विटामिन सी की बात ले लें तो आपको अपने खाने में फिर थोड़ा नींबू रखना पड़ेगा, थोड़े ज़्यादा सिट्रस फ्रूट्स खाने पड़ेंगे। तो ये बातें हैं। तो ऑफ कोर्स जो हमने आज बात किया उसका मेन पॉइंट, फोकस पॉइंट ये था कि सिम्टम्स क्या होते हैं, अर्ली साइंस क्या होते हैं जो एक ह्यूमन बीइंग को ध्यान में रखने चाहिए, इग्नोर नहीं करने चाहिए, और उसके बाद प्रॉपर डायग्नोसिस से ऑफ कोर्स पता चल जाएगा। तो एक न्यूट्रिशन भी ध्यान है, और क्या पता कई बार डाइट ही संभालने से आपकी वो कंडीशन ठीक हो जाती है, कई बार आपको सप्लीमेंट्स भी लेने पड़ते हैं। तो वो तो आपकी कंडीशन, आपकी हेल्थ स्टेटस के ऊपर डिपेंड करेगा, लेकिन दोनों ही चीज़ें साथ लेके चलनी है। और आप ये भी मत भूलिए, हमने बात किया था कि वाटर सॉल्युबल विटामिन 1 से 3 दिन तक रहते हैं, तो बॉडी भी रिजर्व रखती है आपको विटामिन सप्लाई करने की, लेकिन एक पर्टिकुलर ड्यूरेशन तक ही वो आपको सप्लाई कर सकती है। जितना आप ज़्यादा निकालेंगे तो उतना ज़्यादा वापस भी तो रखना पड़ेगा। तो अगर वो वापस आप नहीं रखेंगे और सिर्फ लेते जाएंगे तो कमी तो आ ही जाती है। तो ये बात ध्यान रखें।
तो एक लास्ट क्वेश्चन, लोगों को अपना फूड हैबिट में क्या चेंजेस करना चाहिए, क्या इंक्लूड करना चाहिए ताकि कोई भी विटामिन की कमी ना हो, मिनरल्स की कमी ना हो?
देखिए, जो हम एक बैलेंस डाइट का जो कॉन्सेप्ट है कि सब सारी चीज़ें होनी चाहिए, पल्सेस होना चाहिए, सीरियल्स मत होना चाहिए। अगर हम एक आम भाषा में बात करें तो हम बात करते हैं कि थोड़ा दाल, थोड़ी हरी सब्जी, थोड़ा अचार, थोड़े चावल, रोटी, तो फिर एक फ्रूट्स भी आपको दिन में खाने चाहिए, कितना पानी पीना चाहिए, नमक सही मात्रा में होना चाहिए, ना ज़्यादा होना चाहिए ना कम होना चाहिए। तो ये तो एक डाइट तो है ही, लेकिन कई बार होता है कि किसी को और ये तो एक वेजिटेरियन डाइट हुई, नॉन वेजिटेरियन डाइट्स भी होती हैं, तो कुछ चीज़ें आपको वहाँ से मिल जाती हैं, कुछ चीज़ें इधर से मिल जाती हैं। तो ये एक जो डाइट है जो बैलेंस होना चाहिए वो थोड़ा ध्यान में रखना चाहिए, बाकी तो।
So, well friends, Professor Rasim Mukhawaty explained what are the symptom of determining the vitamin deficiency diseases, and also what about the balanced diet, what we should take precautions for overcoming such diseases. So I hope this lecture must have benefited all of you. And so on your behalf, I thank Professor Rasim Mukhopadhyay for giving such a wonderful lecture, and I also thank all of you for watching the lecture. Thank you very much.